It's pretty wild to think that a farmer in rural Vietnam and a CEO in New York City might share a hidden, life-threatening connection. It's a story that isn't really written in the headlines, but in our very own arteries. Today, we're going to uncover this tale of two divides.
So let's start with a question. What could possibly connect a farmer in Southeast Asia, a doctor somewhere in Europe, and a teacher right here in the United States? On the surface, not much, right? But they are all part of a huge global health story. And the answer is the rising tide of vascular disease. This isn't just some isolated local problem. It's a massive interconnected story that affects all of us. And today, we're going to dig into why.
So, here's how we're going to break it down. We'll start with the global threat itself. Then we'll look at the divide between countries, zoom way in on the disparities inside just one nation, talk about real strategies for change, and finally wrap it all up with why this matters so much. All right, first up, a growing global threat. To really get this story, we need to meet the main villain, you could say, the unseen engine that's driving this entire process.
And that engine is a little something called atherosclerosis. The easiest way to think about it is this. Your arteries are like highways for your blood. Well, atherosclerosis is like a slow-motion traffic jam, a buildup of gunk or plaque that hardens and narrows those highways. It is the root cause of heart attacks, strokes, and something called peripheral arterial disease, or PAD. This one process, it's central to everything else we're about to talk about. Okay, so how does this play out on a global scale? Let's jump to our next section, the international divide. And you're about to see a really stark contrast in how a country's wealth can literally shape the health of its people. So what's fueling this arterial traffic jam all over the world? Well, two main culprits keep popping up again and again: tobacco and diabetes. Smoking directly damages the walls of those arteries, while the high blood sugar from diabetes just speeds up that whole plaque buildup process. And if you look at this chart, you can see that while global tobacco use is thankfully on the decline, there's still this huge gender gap. Men are still smoking at much higher rates than women, especially in places like the Western Pacific. So, yeah, the trend is positive, but the problem is far from solved. And then you have diabetes, which is, frankly, a tsunami of a health crisis. In 2015, we were looking at 415 million people affected. By 2040, that number is projected to swell to a staggering 642 million. And as you can see here, regions like the Eastern Mediterranean and the Americas are right at the epicenter of this wave. Now this is where that divide becomes painfully clear. In wealthier nations, stroke rates are actually falling, thanks to better prevention and treatment. But in low and middle income countries, they're rising at the exact same rate. The burden of this disease is literally shifting from one part of the world to another. And this shift is even more stark when we talk about peripheral arterial disease, PAD, which, remember, is when the arteries in your legs get clogged. Get this, over 2/3, more than 66%, of the 200 million people with PAD live in low and middle income countries. That is just an incredible concentration of the problem. So we've seen the global divide, but what happens when we zoom in? Let's turn our attention right here to the United States and see how these same disparities play out right here at home. And honestly, it's the same story, just on a different scale. The risk factors we saw globally are also at play in the US, but they have their own internal divides. This chart is a perfect example. Diabetes has been climbing for everyone since 1980, but just look at the rates for Black and Hispanic populations. They're consistently higher. And it's the same thing with smoking. The great news is that rates are down overall. But look closer at this chart. The prevalence among American Indian and Alaskan Native populations is nearly double that of non-Hispanic whites. These are definitely not uniform trends. This next slide shows the absolutely devastating consequences of these disparities. What we're looking at are amputation rates for people with diabetes. And the rate for Black patients is more than double that of white patients. You have to ask, why is this happening? The source material is blunt about it. There is a 2 to 4 times higher amputation rate for Black and Hispanic Americans with PAD. I mean, that points to a massive gap in everything from disease awareness to medical management to simply getting access to specialists. But, and this is a big but, this does not have to be our reality. Which brings us to our next section, strategies for change. The data shows us what's broken, for sure, but it also gives us a blueprint for how to fix it. Okay, at the global level, the World Health Organization has a proven playbook for tobacco control. We're talking about things like tax hikes, smoke-free zones, and banning ads. And we've seen it work in countries like Australia, where smoking rates have absolutely plummeted after they put these policies in place. These are tested, effective solutions. But tackling the whole problem requires a three-pronged attack. It starts with policy. So think about cities designed for walking, not just driving. Then it's about the providers, the doctors who need clear, evidence-based guidelines to follow for every single patient. And finally, it's about patients themselves, giving them the education and support they need to manage their health. You really have to tackle it from all three angles. And here's the proof that this stuff works. Back in 2006, Massachusetts made it easier for people to get health insurance. Before that law, there was a huge racial gap in amputation rates. After the law changed, that gap basically disappeared. Policy made a real, tangible, life-saving difference. So, let's bring it all home. We've seen the data, we've seen the disparities. But what does this all really mean for that farmer in Vietnam, that doctor in Europe, and that teacher in the US? The story of vascular disease is really a story of two worlds. There's one world with access to prevention and care, and another one without. And these two worlds aren't just oceans apart. Sometimes they're just a few blocks apart in the very same city. You know, these health disparities are written down in data, but they are felt by people, by the farmer, the doctor, the teacher. So the question isn't just what it will take to rewrite this story. The real question is, what part will each of us play in rewriting it?